Now on GMA, celebrating Black History Month with a look at the state of healthcare and what we should consider when heading to the doctor. Emergency psychiatrist Dr. Adjoa Smalls-Mantey is here to talk with us. Thank you so much for being with us.
Thank you.
What concerns you most when it comes to healthcare and the Black community?
I'm concerned about the prevalence of certain diseases, namely being cardiovascular disease, diabetes, and colon cancer. We have a higher rate of these diseases and a greater likelihood of dying from these diseases. And part of that is due to late diagnosis. We're not getting screening early enough. And so it's important that people be aware of the symptoms, go for regular checkups and those screenings.
And we've been reporting on this more and more recently, but why the continued disparity?
So some of the reasons for those disparities are you might live in an area that doesn't have as many doctors in their hospital. You might live far away from a hospital, but there's also the economic cost of healthcare. Black people tend to be in jobs that may not have as many, that may not offer healthcare benefits, or you might not have health insurance. And so if you don't have health insurance, you're less likely to have a primary care doctor that you're following up with. And then even if you do have a regular doctor that you're following up with, the cost of the actual treatment can be very high for people. There's also the anxiety of knowing what you have. So people might have symptoms and not want to see a doctor, but it's important to go find out. It could be nothing, but also if you have something, there's treatment. And then the very real fact of racism and bias in healthcare and just in this country, we've seen many examples of people going to the doctor, having their concerns and ignored. And it's important to remember that you're entitled to health care, so go and get a second opinion.
Absolutely. And doctor, you have such a calming presence, but I think that there is such an anxiety, right, of going. What do you want people to know about going to the doctor?
When you go to the doctor, I want you to think about a few things. One, tell your doctor everything. Sometimes we are embarrassed about what we're experiencing and our symptoms. Doctors have seen everything, we've heard everything. So symptom A and B can mean one disease, symptom A and C can be something else. So tell us everything. The other thing is when you're going to the doctor, you want to ask them clarification questions. A lot of times we're using big terms, we're telling you something new, and so you want to find out what that is. Don't be afraid to ask us to repeat things. And finally, bring someone with you. That person can be an advocate for you if you feel like you're not getting the right treatment, but they can also help relieve that anxiety of just going to see the doctor.
And real quick, what do you tell people about how to advocate for themselves when they're talking to the doctor?
I tell people it's okay to say, you know what, I really want to make sure that you understand what I'm saying. I think it could be this. Can you look into this as well? It's okay to ask us to do more, do something else. You know your body, you know what is different. And there's also something called a patient advocate in hospitals. So if you feel like your doctor's not listening, you can call the healthcare system, the hospital, and ask that person to be an intermediary for you if you don't have a friend to come.
Yeah, important reminders there.
Yeah.
Thank you so much for being
So
with us,
fantastic.
Dr. Smalls.